Jamaica now has 396 confirmed cases of COVID-19. That was revealed at a Ministry of Health digital press conference a short while ago. Vashan Brown now joins us live with the latest. Vashan?
All right, thank you so much, Andrea. So within the past 48 hours, that's between yesterday and today, Jamaica recorded 32 new positive cases of the coronavirus.
Of the 32 new cases, there are 11 males and 21 females, with ages ranging from 1 to 71 years. 15 are associated with the workplace cluster in St. Catherine. 11 cases are contacts of confirmed cases and 1 imported case, and 5 are under investigation. Of the 396 confirmed cases up to now, 202 are employees of the workplace cluster in St. Catherine. Their ages range from 18 to 53 years. They include 151 females and 51 males. They are primarily from the parishes of St. Catherine and Kingston and St. Andrew.
Now, that workplace cluster that the health minister spoke about a short while ago is the Alorica call center in Portmore, St. Catherine. Now, one of the employees at a new Kingston-based call center, Centerfield Media, tested positive for the coronavirus. The Kingston and St. Andrew Health Department yesterday served a closure notice on the BPO facility, which is situated on Trinidad Terrace in the heart of the financial district. It said the call center was ordered closed for non-compliance under the Disaster Risk Management Order. The health minister, Dr. Christopher Tufton, also addressed to that matter today.
The employee, a resident of St. Catherine, has been placed in isolation at a government facility. The health departments in Kingston and St. Andrew and St. Catherine have begun contact tracing to ascertain those who may have come in contact with the employee with a view to quarantine or isolate, test and treat as is appropriate. The BPO has been temporarily closed to facilitate supervised cleaning, including the HVAC system. Of note is that the management of that entity has been in compliance with the recommended social distancing. While scale testing of the staff is not recommended at this time, however, some employees will be sampled. In other words, based on the risk assessment, some employees will be tested. However, it is not determined at this time that the individual who has tested positive picked up the virus from the particular facility.
The health ministry officials were also asked about the number of healthcare workers who've tested positive for the coronavirus in Jamaica.
We have 5 health workers that are currently positive for COVID-19. We have conducted a series of tests for the Ministry of Health and Wellness. As you are aware, we had 7 cases confirmed. Since that time, we have done sampling for over 300 members of staff, and we're receiving those results we're receiving those results now. So I am hoping to have those numbers available by tomorrow, so that we would be able to report on the exact number of persons in the Ministry of Health and Wellness that have been impacted.
And you're listening there to the Permanent Secretary in the Ministry of Health, Dunson Bryan. Now let's go back to our lead story for a moment, because issues relating to how the Jodian Ferron matter was handled did come up at today's press briefing. Among other things, the health minister says he's concerned about the operations of private hospitals.
I've not made a big issue of it, but I've asked for a report on what are the sort of requirement protocols of how a private entity operates, because, you know, I do think that the time may be now for us to have a stronger regulatory framework in terms of what is required to establish a hospital. Now, I'm saying that without casting any blame on the particular institution, because I don't have all the information. But the truth is, part of my request for information is to get information from an entity that I do not have control over, which is the Andrews Memorial Hospital. And it does, even though I've had an account that was made public through a statement, it does create a level of incompleteness that I would prefer to have had greater authority to request or to require. And as a consequence, I think there's going to be a need, I think, in my view, to relook at that.
So Andrea, that's the latest from today's press conference.